If we're going to empower young people to take ownership of their health, we need to, in the healthcare setting, be talking about one of the biggest risks to adolescent health, which is risky substance misuse.
We are good at immunizations, we're good at talking about diet and exercise, and we're good at a lot of different things. But talking about substance misuse was challenging, and figuring out how to bring it up and how to begin a conversation was an area I knew that we could do better in.
We're asking the question about substance use, but we weren't asking it in a standardized way, and we wanted to figure out how we could ask our patients about substance use in a valid, evidence-based way, and SBIRT was able to help us with that.
SBIRT stands for Screening, Brief Intervention, and Referral to Treatment, but what we're really talking about is introducing conversations about alcohol and drug use to kids as part of their primary medical care.
What is the age at which young people who report using begin to use? And very, very often that can be as young as 11, 12, or 13 years old, and we know that kids who begin using any substance, it does not matter what kind, any substance, before the age of 15 are 4 times more likely to develop a full-on substance abuse disorder.
We have the ability to introduce prevention messages if we start early and catch kids before they start, or otherwise try and catch kids very early after they start when it's easier to ask them to quit.
Hey, I'm Lexi. I'm here for my appointment.
Good morning, Lexi.
Our patients have been receptive to SBIRT screening. We have kind of a low-tech method to do the screening. We have dry erase forms that we are able to reuse. Patients are used to filling out forms, so it is just another form for them to fill out.
For some people, it's much easier to face the computer and answer questions as opposed to facing a human being.
So I'm going to hand you my tablet. And it's a touch screen, so you can scroll down.
I have a little overlap, which is that we have added the True Questions screening for depression, and I do have quite a few young people who screen positive for depression, and so that has been an important adjunct to this work. We thought we were screening for depression before, but we're definitely getting more answers in this way.
It's only for you to fill out. Your provider is going to review it.
We also have some extra questions built in around there about binge drinking, about smoking, about prescription medications and other substances. And I tell you, once we started just asking the question, it's amazing what kids will say. But I did see that you indicated that there are some friends or some other kids that you know in school who are. Can you tell me more about that?
So it's not really any of my close friends, but I know
that barrier of bringing up the issue that we were worried about is not a barrier. Kids want to talk about it, and if we bring it up at an early age and we bring it up every year, the awkwardness just dissipates. It changes our culture. It changes what we do as a practice.
For us, I think the best news and the best feedback that we've had is that kids in the community are talking about it, and it is becoming just part of the standard routine and an expectation. And that's the goal. If they feel like it's a normal thing to do and everybody's being asked the question and no one's judging them, then next year or the year after when they come in, we've opened that door for that conversation even if they're not ready to have it today.
For kids who have not yet initiated substance use, it's a real opportunity to give them positive feedback and prevention messages. For kids who've just started using, that's an ideal time to encourage them to stop and give them medical advice on why it's so important to their health. And there's been research that shows that that works.
I know a lot of people that do smoke, but they're not really bad and stuff like that.
As professionals, we might feel like we're preaching or that it's impractical to give kids health advice, but really quite the opposite. Kids are looking for it.
It was a couple months ago, a family called and they said, my son would really like to talk to you. He's gotten in trouble, he's been suspended from school, and he really wants to sit down and talk with you. And it's because we asked, it's because we had that conversation earlier.
Made a couple bad choices and it kind of spiraled into something.
My assistant will often come to me and just say, they had no's on all the craft questions, and that's great to hear. Or I might hear she answered just one. And we have a dialogue. We form a relationship. We continue to have these discussions.
So there's been this cascade effect of focusing on substance misuse, but it's made us much better listeners. It's made us much better doctors with adolescents. And we all have a role to play. We're in an epidemic. And the kids that we're seeing may not be overdosing, but they're maybe at risk. Their lives may take a turn where that becomes more of a possibility for them. And if we can build some resilience, or at least build the expectation that if you ask for help, someone will listen, then we've done our part.